What is the role of a biliary stent in unresectable cancer? Imagine a situation where a tumor in the pancreas has grown so much that surgery to remove it isn't possible. In such cases, doctors focus on relieving symptoms and improving quality of life. One important tool they use is a biliary stent. This tiny tube helps keep the bile duct open when a tumor blocks it. Bile is a fluid that helps digest fats and is made in the liver. When the bile duct is blocked, bile can back up into the liver and bloodstream, causing jaundice, which makes the skin and eyes turn yellow. It can also lead to itching, infections, and liver damage. Unresectable pancreatic cancer, the tumor often presses against or invades the bile duct, causing this blockage. To fix this, doctors perform a procedure called endoscopic retrograde cholangiopancreatography, or ERCP. During ERCP, they insert a small tube through the mouth and into the stomach to reach the bile duct. They then place the stent across the blocked area. This allows bile to flow freely from the liver into the intestine, reducing jaundice and other symptoms. There are two main types of biliary stents. The first is a self-expandable metal stent, which is made of a flexible metal mesh. These stents are larger and stay open longer, making them ideal for patients with unresectable cancer who need longer-term relief. They tend to have fewer blockages over time. The second type is a plastic stent, which is less expensive and easier to insert but tends to clog faster. Plastic stents might be used if the patient's expected survival is short, or if metal stents are not available. Choosing between a metal or plastic stent depends on how long the patient is expected to live, their overall health, and what resources are available. Metal stents are generally preferred for longer-lasting relief because they reduce the need for repeat procedures. Biliary stenting is less invasive than surgery and carries fewer risks, making it the first choice for palliation in unresectable pancreatic cancer. In some cases, stents are used to manage jaundice during treatments like chemotherapy or radiation, especially in locally advanced cases. However, care must be taken because stents can sometimes cause complications such as bleeding or perforation, especially when combined with other therapies. Overall, biliary stents serve to unblock the bile duct, alleviate symptoms, and help prevent complications like infections or liver problems. They are a vital part of supportive care for patients with unresectable pancreatic cancer, helping to improve comfort and quality of life when curative surgery isn't possible. Always remember, each patient's situation is unique, so treatment decisions should be made in close consultation with healthcare professionals.